Dr. Pan is the Director and State Public Health Officer, California Department of Public Health. Dr. Pan leads California Public Health Initiative with a commitment to equity, dignity, and community empowerment. Since becoming the director in February of 2025, she has championed a health in all policies approach that recognizes social detriment of health as fundamental to thriving communities. Her extensive experience include serving as state health scientist and acting public health officer during critical public health responses, plus decades of work in infectious disease prevention, both at state and local levels. Dr. Pan also maintains her role as a clinical professor of pediatric infectious disease at UCSF. So without further ado, Dr. Pan, the floor is yours.
Great. Thank you so much. Good morning, everyone. And thank you for the opportunity to present and meet all of you in the Bill Advisory Committee. So this morning I'll be talking a bit about just a little bit of an overview about our health department at the state level here in California. Actually, let's go to the next slide. And just another quick bit, as mentioned, I've been in this role for about, I guess about 6 months since February. And before that was the overseeing our Center for Infectious Diseases and our state epidemiologist. Just, again, many of you may have seen this in prior presentations from prior CDPH directors, but, our mission is to have healthy and thriving families and individuals is our vision in California, and advancing the health and well-being of California's diverse people and communities. And that, of course, absolutely includes people living with disabilities. And we have some strategic pillars, and I want to give a lot of credit to my predecessor, Dr. Aragon, for really, continuing to have core pillars as far as our pillars and values about being learning, healing, and impactful. So we're always wanting to be the best at getting better. We spend a lot of time thinking about trauma responsive organizations and healing, especially given how hard it's been, not only for the entire world and community post-pandemic, but our public health workforce specifically has just had a really, really challenging experience over the last 5 years. And of course, being impactful again to meet our vision and mission. Next slide. And then we have just launched, actually in transition to the prior director and myself, a new strategic priority and plan for the next 5 years. We're admittedly, because of the federal impacts, which I'm going to talk about in a bit, kind of in the process of refreshing this even more a little bit. And we're having to really think about reimagining public health because we are so impacted and we could lose, a very, very, very significant proportion of our funding. And I'll talk more about that later. But just to sort of share, we continue to really emphasize developing our own people and developing and supporting our people in our workforce. We need to continue to improve our ability to respond to public health emergencies and response. So really taking lessons learned from the pandemic and other emergencies. And a lot of that, again, is so important, not only to be responsive to our communities, but also try to improve resilience of our staff and minimize burnout. And really trying to embrace data modernization. So parts of the ways we can reimagine our thinking about how to maintain some of the gains we've made with technology and data modernization, really improving our data and ability to collect data and use that to inform health impact and health policy. And then really important, and especially in this time, is a huge focus on communication. How do we rethink how we're communicating to our communities, improving how we communicate to our own workforce? I think our old ways of doing that are not effective anymore and working. So we're really trying to think about, I've been calling it, using my public health officer stethoscope to listen to our communities better and really use that information to provide feedback on how we're communicating, what our messages are, and also what we should be prioritizing. And then advancing healing, equity, and health equity, and just overall promoting healthy communities. Next slide. And then just to briefly mention, again, to give you an overview of the kinds of work we do programmatically, this slide is related to the public health accreditation across the country and what we call foundational public health services. So a lot of what we focus on. My kind of prior expertise and interest has been communicable disease control, but of course, chronic disease and injury prevention are incredibly important, and that includes a lot of work related to mental health and behavioral health and substance use, environmental health, maternal, child, and family health, and then really helping work with healthcare partners on access and linkage to clinical care and safety net. And then there's some foundational capabilities related to those, which you all can have these slides later. I won't walk through all of those, but those are just capabilities we need to support those foundational areas. And of course, again, equity is underlying all of that and continues to be important to us, and an underlying just core to what we do. And that's not going to change no matter what happens with other priorities federally or nationally. Next slide. And then just really briefly too, we were asked to kind of just briefly talk about how we're organized as a department. So sort of my roles in the middle as the director and the state health officer. We have a very strong relationship with local health departments, and I'm really proud, and I think it's really important experience I have to having had that local health experience. So we have a conference of local health officers that in statute is advising us as a department. We have an Office of Compliance, an Office of Health Equity, and then Legislative and Governmental Affairs. And then moving from left to right, we of course have like core operations, health quality and emergency response. So everything from licensing and certification for several different kinds of healthcare facilities, our lab, our public health laboratory, again, other work with our local and regional public health offices and emergency response are all in that area. And then infectious diseases and disease control. Our binational border health and refugee health are also in that bucket. And then we think of a lot of our other chronic diseases in the population health bucket. So Center for Healthy Communities is where a lot of the chronic disease, substance abuse, others, Center for Family Health and Maternal Child Health, environmental health, and then our vital registration. So all those birth certificates, death certificates, and all the data related to that are in the Center for Health Statistics and Informatics. And then we have some cross-cutting areas as far as our Office of Professional Development engagement that of course works closely with our HR department, policy and planning, communications, and legal services. Next slide. So shifting gears to the impact of federal policy changes. Next slide. So in broad strokes, I mean, to share with you, so you may have been hearing in the news that our colleagues at CDC, and first just a moment of acknowledgement to Officer Rose, who lost his life helping defend my colleagues at the CDC and public health leaders. And this has gotten very, very little coverage in the media, and certainly not a lot of acknowledgement from federal leaders around the, apparently hundreds of bullets were shot at our federal public health department colleagues. And they 80%, and they've been threatening to cut a huge proportion of their funding and reorganize and eliminate many, many programs there prior to that really, really sad and tragic incident. CDC's budget is proposed by the presidential budget to be cut in approximately half. 80% of their funding goes to state and local health departments. So when you cut that at the federal level, that cuts us at the state and local public health level. Our state health budget is probably almost 45% federally dependent, and 2/3 of what we have in our budget goes to local health departments. So there's a very much cascading effect of all of these things. I'm sure you're all tracking. There are huge impacts as related to Medicaid, and defer to my Department of Healthcare Services colleagues who've done some great summaries of those impacts and our huge concerns around that. A cross-cutting area around nutrition assistance is something we work closely with the Department of Social Services and us, but for us, this is all of our chronic disease prevention, nutrition, obesity prevention is all in that, and that is actually already been eliminated. So that is potentially up to 50 personnel impacted that we're working to find, other positions for and other things. So lots and lots of grant delays and terminations. And then there's just so much back and forth, as you all may know, related to what gets put into what has been in the proposed presidential budget. There have been intermittent rescissions threatened and or followed through. Some of them have been stopped with legal actions, thankfully. But that also just leads to a lot of uncertainty and a lot of challenges for the public health community at whole. There's been a lot of challenges as well to any kind of drawdown of the current federal funding we have, or sometimes they're not giving us all of our current allocations. It's just really, really been challenging. And then, of course, as they do their kind of off and on reorganization and elimination of things, they're losing a lot of expertise at the federal level. They've, as I'm sure you've heard, have eliminated many, many federal important advisory groups that are external partners advising that the whole healthcare community really uses to help provide national consistent guidelines for everything from vaccines, preventive services, preventive screening. So a lot of that is happening that is hugely concerning. And then, of course, a huge chilling effect that I'm sure you all are seeing across all of your departments related to immigration enforcement, and that's really impacting participation in programs. Again, back to just basic nutrition programs like our women, infants, and children programs, and a lot of other things like that. So it's lots of disruption, again, as I'm sure you're all experiencing as well. And then, of course, we're really tracking and concerned about data privacy and security and what's happening in that realm. Thankfully, what we have to report is typically aggregated data, and we're really relooking at all of the things we do report and how we can continue to safeguard or protect or, really protect our communities from misuse of any data that we are collecting in trying to care for our communities. And then related as well to the advisory groups and loss of expertise, there's just a lot of scientific policy, leadership, research that is not going to be happening anymore with federal impacts. Next slide. And then our team put a couple great quotes together from the Center for American Progress, but this has really clearly also been quite threatening to people living with disabilities, in addition to other protected classes. And there's so many executive orders that are rolling back civil rights protections to legislation. They're cutting key services and support, and there's structural violence in the form of federal policy that is again, I'm sure many of you are aware of this, but it's sort of helpful to see it starkly put on a slide. Dismantle, cutting our public health infrastructure funding that I already spent a bunch of time on, that's protecting and supporting the health and well-being of disabled people, removing the ability of disabled children to receive free, appropriate public education, and cutting all kinds of services, benefits, and regulations that help keep disabled individuals in their communities, and decreasing those protections in employment. Next slide. And then as far as staffing reductions, I started to allude to this, but again, some concrete areas where we're seeing really specific cutting at the federal level. Nearly half of the employees from the Department of Education's Office for Civil Rights, 70% of the lawyers at the DOJ Civil Rights Division, the entire Social Security Administration's Office of Civil Rights and Equal Opportunity, 90% of federal contract compliance programs, the Department of Labor, half of the Equal Employment Opportunity staff of the Federal Trade Commission and NASA. And then planned dismissals of other staff from the Office for Civil Rights and Liberties, Department of Homeland Security, Office of the Immigration Detention Ombudsman, and at least 30 staff from the Office of Citizenship and Immigration Services Ombudsman. And then as far as other funding termination, there's proposed termination of 2/3 of the Housing and Urban Development Fair housing enforcement grants as well. So a lot of stark cuts in this really important area. Next slide. So another quote from the Center for American Progress, in July when we had our Disability Pride Month and that 35th anniversary of the passage of ADA, is really crucial that people living with disabilities don't let all this just chaos of all the harmful policies demoralize or divide our community. Disabled people have led the way to protect services and support during prior Trump administration and now. So I think, we're feeling this across just the public health community in general too. Like, it's more important than ever for us all to really build strength and partnerships and teamwork and taking care of each other as we work on how we navigate the current environment. Next slide. And then just shifting gears to our CDPH Disability Advisory Committee. Next slide. there's some nice a newsletter. I'm kind of going in backwards order, but that our team does that really, and this is a snapshot of that kind of provides some information about our members and the mission and purpose and goals. And this newsletter has a lot of awareness and training and policy updates. And engages in various educational efforts for presenting to our teams. And at a lot of our department events, we had every time we have our award ceremony every year, we have a showcase, and our DAC gets to have a table there. That's actually where I got to meet some of our members. And of course, this is part of our EEO program, under the California Government Code section that I'm sure you're all very, very aware of. And our advisory committee advises me as the director on issues relevant to employees with disabilities. So our goal is to have department-wide representation of members who can present awareness of all of the different types of disabilities represented in our employees, and then, as well as the various geographic work locations across our department. We work closely, the committee works closely with our Office of Compliance and collaborates with our employees to identify areas where we can get better to support employees with disabilities to succeed in the workplace. So we are authorized to have 15 members to have 2-year terms, and we currently have 11 members in our, I believe, in some recruitment efforts. Next slide. And so some of our key areas of focus in the DAC: outreach with our HR recruitment unit to strengthen our partnerships and collaborations to help continue to improve our parity rate and recruitment of people with disabilities. This committee leads our National Disability Employment Awareness Month events, including a webinar for all our employees and participating in recruitment events focused on recruitment. We have twice annual review of our reasonable accommodations data to identify potential areas of improvement or changes in policy, and ensuring that there's representation in our initiatives for inclusivity. Also participating in other department initiatives related to building a culture of belonging. So as part of our healing and learning, we're really working hard to improve our culture of belonging across the department. And so that includes everything from, addressing structural racism and also addressing belonging for our employees with disabilities. Next slide. And then, of course, wanted to kind of share where we are with our parity rate. So our goal disability parity rate is 16.6%. That's been our goal for the last several years. Dip, I think, post-pandemic a bit, but in last year in 2024, we were back up to 14%. So we're encouraged by that improvement compared to 2020, and aim to continue to improve on that to get to our goal. And this is part of our EEO program, and we have an annual workforce analysis survey that's also mandated, as you know, and supplies the CalHR updates on our workforce demographics. So some of the things we've been doing are just, again, increasing our work on awareness, training, policy updates, and targeted recruitment, introducing training on updated and hiring guidelines across our department, and then working on hiring a diversity analyst and the development of a recruitment outreach diversity plan within our HR division. Next slide. And then as far as looking at our reasonable accommodation process, we of course comply with ADA and the Fair Employment and Housing Act, and all civil rights laws that prohibit discrimination. And these are managed through our HR division, disability management section. Requests go through an interactive collaborative process to find a solution to assist the employee to perform essential functions based on any limitations outlined by their medical documentation. And of course, RAs may be approved with modification to ensure they meet essential functions of the job while also supporting the limitations the employee may have. And then any reasonable accommodations requests can and determinations can be appealed with the Office of Compliance and State Personnel Board. And then there's also other avenues of appeal, including the California Civil Rights Department and the U.S. EEO Commission. Next slide. I know there's been some interest and evolution about related to hybrid work environment and return to office requests for RA and leave. And there are, this has been included in options for employees to apply for an exception based on, as we all know, we've been back and forth on whether it's 2 days a week or 4 days a week. Now, most of the unions have negotiated to go back to 2 days. So, we've been doing surveys as well as part of our DAC. And, again, I just want to circle back to, and public health specifically, so much of what we are about is about equity and really, and inclusivity and really addressing disparities where they are, no matter what the sort of disparity may be related to, whether it's people with living disabilities, race, or other protected classes. Next slide. Just a thank you and acknowledgement slide to a lot of the team members who helped pull this information together for me across our different department. Next slide. And then I can pause for questions. Sorry, I took a little longer on the speaking versus Q&A. I do need to jump off at about 9:30, but I'm happy to take any questions between now and 9:30.
Great. Thank you so much. That was very informative presentation, Dr. Pan, very valuable. We'll open it up for questions for Dr. Pan. One quick question I have for you. I understand you mentioned during the presentation that 45% of the funding is federal funding. And so there is, in your words, 100 bullets were shot to the public health programs. So there's going to be a number of people not finding the program that they worked for. What's the plan for CDPH to find them different assignment?
Yeah, I mean, we're sort of to talk about this at a high level, a couple of things. We are, following all of sort of the state sort of, usual processes to do that. I think what's been so hard in general is that there's been so much uncertainty and ups and downs on what is proposed to be cut, what's actually going to be cut, what there have been legal action to prevent cuts or changes. So, but I think so the bottom line is we're prioritizing our people, and we, currently there's only been one set that's actually stuck for now that we're working on, redirections and sort of the normal processes, and really hoping for ongoing advocacy that, we're really waiting with bated breath to see what happens with the next FY26 federal budget. And, anyway, it's been all over the map, I think, as far as what we're seeing. And I just want to actually clarify too, when I said hundreds of bullets were fired, there was a shooting at the CDC. And our partners there were threatened. So that's actually what I was talking about. And before that happened, everyone was feeling threatened in the public health community based on all these fundings and reorgs at the federal level, et cetera. But there was actually a shooting, thankfully, thanks to really good security there. And then this police officer who lost his life in that shooting, there were no deaths of CDC employees, but it's just a really, really scary time for public health. So I just have been wanting to acknowledge it because I think a lot of people haven't even heard about it. And if there were any other federal department that had that kind of a situation, there would be a much bigger response. And it just sort of speaks a lot to how the federal government is valuing public health right now. And honestly, the general public, because people are not really talking about it.
Right. Thank you so much for clarifying. You weren't just speaking anecdotally. There was an actual event that we're all aware of. Thanks for bringing that up. Michelle, you have your hand up. Please unmute. Ask your question.
Thank you so much. Can you hear me? Okay,
Yes.
So I don't know, can you talk to the emotional toll that all of this stuff going on in the federal government is having on your team, and how do you keep everybody moving forward and feeling positive or hopeful?
Yeah, I'd say the biggest challenge of one of the biggest challenges of my job right now, honestly. It is really, really tough. And I just want to also name that even before this federal transition, I think our workforce has been incredibly burnt out and tired after the pandemic. And we felt under-resourced and undervalued even before all of that. And now that this is happening. So I think a couple things we are doing. We have been over the last several years, actually, even before this federal impacts, working to become a trauma responsive organization. So there's been a lot of training. The group we've been working with is called Lodestar, but we have had a lot of training and ongoing sort of coaching related to being trauma responsive and really trying to have our leadership in our organization and more employees. I think we're at a pretty high proportion now. I forget the numbers, but we're increasingly having more and more of our teams and staff getting this training and coaching to really be cognizant of how to work with each other and be trauma responsive and know that sometimes things are activating. And we're trying to, the other way I've been thinking a lot about this is, well, what are ways we can seize the opportunity to reimagine public health? What are things we want to really look at prioritizing? And then how do we make the moment by also looking at, well, are there things that, historically we've been required to do that don't actually have a big health impact? Can we make the case to think differently about those resources? So we're kind of in process of that too, but really trying to help all of us think about, well, where are there some of the opportunities in this? But it is really, really hard. And I just absolutely acknowledge that I think the entire public health community and certainly our department workforce is really, it's really demoralizing and really hard.
Thank you. We have President of AXME raise your hand. Please unmute and ask your question. And I should tell everyone, Dr. Pan has very limited time left. This might be the last or second to last. I'll leave that discretion to Dr. Pan.
Yeah, this might be the last, and then happy to, maybe Michelle, if you don't mind staying on a minute or two longer, take any questions back. And then I think some of our other CDPH reps are on the council that can bring back other questions.
Thank you.
Hi, thank you for your time. My name is Juan Del Toro, and as you stated, I'm the president of Local 2620 for AFSCME. I was just curious of how we can make sure that we hold, supervisors or the department accountable for implementing these reasonable accommodations that we've been hearing so much about.
Yeah, I mean, my understanding is working through the appeals process. If there's a concern that reasonable accommodation has not been made, then basically going through that appeals process. And I think even on the slide, there were a few different routes to do that to address.
Thank you for your question. And Dr. Pan, I'm not going to keep you any longer than you have been very gracious, and we really appreciate your sharing all this information with us. So please come back and see us anytime. You're always welcome, and have yourself a wonderful day. And Michelle, if you want to continue on with the Q&A session, so Dr. Pan can leave, and hopefully you can answer a couple of more questions. Alex, go ahead.
Oh, and I don't know that she can answer questions, but can take them back.
Yeah, I'm happy to write the questions down so they can go to Dr. Pan. Yeah.
Okay.
Sure, we can get back.
Thank you so much. Thank you for all the work that all of you do. It's greatly appreciated. And yeah, nice to meet many of you virtually.
Thank you, Dr.
Thank you.
Bye.
Alex, go ahead and post the question to Michelle, and Michelle is gracious enough to take it back and provide us with a response. Right, Michelle?
Right. Thank you, Michelle. So in the chat, I'll read it out loud for participants. It's asked, will CDPH be seeking or granted more state funding to help compensate for health efforts that are being dismantled or damaged at the federal level in areas such as, but not limited to, disease prevention, including vaccines, research and development, public health communication campaigns, and partnership with global health entities like the WHO? So I don't know if you can answer that or if you can take that back to your agency through a copy paste, perhaps.
Yeah, I'm not able to answer that, but I do have it copied here, and I'll make sure that gets back to folks.
Okay, excellent. Thank you. And then another thing as well, if it's possible, it was asked by another participant if it would be possible to read the quotes for those who are blind and cannot see the slides. So I don't know if we have the slide deck and can pass it on to the person that asked the question.
Yeah, we did share the slide deck. I think that's wonderful to have that shared out. I can read them now too, if that is something that you all would like to do. I know you have limited time on your overall agenda, but
just let's go ahead for the benefit of everyone and being inclusive. Read just that one particular slide, please.
Yes, I think there were two slides with quotes, both from the Center for American Progress. So The first said, history will show the first 6 months of the second Trump administration as an all-out war against disabled people. From executive orders intended to roll back civil rights protections to legislation that cuts key services and support, the disability community has faced structural violence in the form of federal policy.
Thank you.
And the second one here, again, also from the Center for American Progress, says, as the United States commemorates the 35th anniversary of the passage of the ADA and celebrates Disability Pride Month in July, it is crucial that disabled people do not let the barrage of harmful policies demoralize or divide the community. Disabled people have led the way to protect services and support during both Trump administrations.
Thank you, Michelle. One of the question came up, and that is specifically wondering if the AIDS drug assistance program will be experiencing cuts. This program provides HIV and AIDS drugs to income-eligible Californians. Will ADAP be able to continue to serve the same amount of people?
Okay, I have that written down as well.
Okay, great.
All right, thank you. And then one more question I saw in here is if someone could provide the link and or contact info that the trauma organization Dr. Pan mentioned. So I don't know if you could obtain that as well post-meeting.
Yeah, absolutely.
Please and thank you.
Absolutely.
Thank you, Michelle. We really appreciate your cooperation and help. We couldn't have done this without your assistance.
Absolutely. Thank you for having Dr. Pan join this morning.
Thank you. And you're welcome to stay on if you like to, but I'll leave that up to you. But thanks again for joining.